Have you ever woken up and realized one of your ears just isn't hearing as well as it used to? Or maybe during a phone call, one side suddenly sounds muffled. It can be quite startling and concerning when your hearing changes out of the blue, making everyday sounds seem distant or unclear. When you experience a sudden change in your hearing, it is considered a medical emergency. The most common and often effective initial treatment involves corticosteroids, which are frequently prescribed orally. Sometimes, depending on the situation, they might even be injected directly into the ear. The urgency comes from a critical window of opportunity. Sudden hearing loss, particularly when it is sensorineural, is believed to be caused by issues within the inner ear, which is a delicate and complex structure. Potential causes include inflammation, viral infections, or problems with blood flow to the tiny hair cells responsible for hearing. Corticosteroids work by powerfully reducing inflammation and swelling in the inner ear, which can help to restore the function of those vital hair cells before permanent damage sets in. Acting quickly is incredibly important because the longer the delay, the lower the chances of a full or significant recovery. Think of it like a muscle strain. Early intervention helps it heal better. If you notice a sudden drop in hearing, perhaps experiencing a muffled sensation or difficulty understanding conversations, the first and most important step is to see an ear, nose, and throat doctor, also known as an ENT, immediately. This is a medical specialist who can expertly diagnose and treat conditions affecting your ears. They will perform a thorough physical examination of your ear and conduct a diagnostic hearing test, called an audiogram. This test precisely measures your hearing thresholds and confirms the type and extent of the hearing loss. Treatment, typically with oral steroids, should ideally begin within the first 72 hours for the very best outcomes, though it can still be effective if started up to 2 weeks later. Do not delay seeking professional medical help. This condition is formally known as sudden sensorineural hearing loss, or SSNHL. Interestingly, in a significant number of cases, doctors cannot pinpoint an exact cause, which is then referred to as idiopathic SSNHL despite the unknown origin. These cases often respond quite well to prompt treatment. Beyond steroids, some specialists might also consider additional treatment options. For example, hyperbaric oxygen therapy, which involves breathing pure oxygen in a pressurized room, can sometimes be used as an adjunctive treatment, especially if steroid treatment is not fully effective or if there are specific reasons you cannot take oral steroids. The goal is always to maximize oxygen delivery and healing to the inner ear. Remember, a sudden change in hearing is not something to ignore or hope will go away on its own. It is a treatable condition, but timing is everything. Seeking prompt medical attention from an ENT specialist and initiating treatment quickly can significantly improve your chances of regaining your hearing and preserving this precious sense for the long term. Your hearing health is worth swift action.